Hello, this is our research project on Tommy John surgery by Tyler Blomster, Ryan Fidel, Ethan Francis, and Aaron Moore.
Tommy John is the surgery that repairs the most common injury in Major League Baseball, which is often called pitcher's elbow, since it commonly occurs among pitchers. It was nicknamed Tommy John because he was the first person to ever receive it back in 1974. The surgery consists of reconstructing and replacing the ulnar collateral ligament, or UCL, which is in the elbow. It has been performed over 1,800 times since it was first suggested and completed by Dr. Frank Jobe.
The ulnar collateral ligament, or UCL, is the ligament which Tommy John surgery is used to reconstruct. The UCL is located on the inside of the elbow and connects the humerus, the upper arm bone, and the ulna, the posterior bone in the forearm, and it also stabilizes the elbow joint. It is made up of 3 bands: the anterior band, the posterior band, and the transverse band. The anterior band is the most important for stability and is most likely to tear in overhand throwing sports. Tears in the anterior band usually occur in experienced athletes in throwing sports, as overuse wears and damages the ligament. Traumatic events may also cause a tear, such as a car crash, a fall, or other forceful blows to the elbow.
Ligament reconstruction first started being researched in the early 1900s, but Frank Jobe was the first doctor to make a UCL reconstruction surgery a reality. The first surgery was performed on Tommy John, a pitcher for the Los Angeles Dodgers. He had been complaining about elbow pain for most of his career, but in 1974 he thought his pitching days were over and he would have to retire due to the pain. Dr. Jobe had other ideas and told him about his revolutionary experimental surgery. Thought to only have had a 1% chance of success, Tommy John agreed to do the surgery, and against all odds it was an overwhelming success. A second surgery ended up being required to remove scar tissue, but 1 year later he was back on the mound. Tommy John went on to pitch 15 more seasons in the major leagues before retiring at age 41.
There are 5 main types of Tommy John surgery. Obviously, the main option is the original method of Tommy John surgery. An experimental procedure known as primary repair has emerged as the most effective alternative as it allows athletes to return to play in a shorter amount of time. Prolotherapy, stem cell therapy, and PRP therapy are all less invasive and non-surgical options that use multiple injections over a period of time to heal the torn ligament.
The surgery today is not done much different than that of the first surgery Dr. Jobe did. In the first ever surgery performed on Tommy John, Dr. Jobe took a tendon from John's forearm called the palmaris longus tendon. He then drilled holes in the humerus and ulna bones and grafted the tendon in a figure-8 manner, held in place by anchors. Today the surgery is pretty similar. It takes between an hour and 90 minutes to complete. First, the surgeon has to choose which tendon to harvest and use for the surgery. As of now, there are 3 tendon options that doctors use: the palmaris longus tendon, a hamstring tendon, or a big toe extensor tendon. An incision is then made at the elbow joint in a curved shape going about 2 inches up the arm and also down the forearm. The surgeon then will assess the damage of the UCL and will either completely remove it, or if there's still some good parts of the ligament, the surgeon will attach the remaining ligament to the tendon to reinforce it. Holes are then drilled in the humerus and ulna, and the graft is threaded through the holes in a figure-8 pattern.
An experimental procedure known as a primary repair method with internal brace has emerged as a potential alternative to Tommy John surgery. The procedure uses a technique pioneered by Dr. Gordon McKay, in which a product called suture tape is attached to 2 screws and inserted into the bones at each end of the ligament or tendon. This provides a framework or a brace which the ligament or tendon can heal against. Because the suture tape is porous, the damaged ligament or tendon grows through the lattice of the suture tape and it is supported by it as well. This method is great for partial tears, as the doctor will be able to use most of the damaged ligament with the help of the suture tape. Since this method is less invasive and is using a brace, it allows the athlete to start rehab early and has an accelerated return to play compared to the other options.
Stem cells are the raw material that all other cells in the body are made of. The stem cells are very controversial because one method of gathering them is from embryos. Currently, a new method is being developed to use an individual's own bone marrow stem cells instead, but does not seem to be as effective. Once they are gathered, the stem cells are injected into the elbow and rapidly heal the damaged tendon. This is a one-time injection, and the stem cells will continue to work up to a year later. This method has seen incredible recovery times, while some players have returned to pitch 12 to 15 weeks later. There's no real downside to this treatment except that most studies have been done with partially torn tendons only. Surgery still may be required if it is completely torn.
PRP stands for platelet-rich plasma. It starts with a collection of the patient's blood. The plasma is then separated from the blood and prepared for injection. The platelet-rich plasma is then injected into the UCL of the patient. The platelets have both a healing and a growth component, which together initiate the healing of the UCL tissue. These growth components help promote both the growth of collagen and protein synthesis in the tissue. Treatment amounts can vary, but are usually anywhere from 3 to 6 times total, with a 4 to 6 week interval between each round of treatment.
Prolotherapy is a regenerative injection treatment used to treat joint and spine pain by repairing damaged or weakened ligaments and tendons. It is also used as an alternative to cortisone shots. Benefits compared to the other options is that it is much more affordable and you can treat multiple joints or ligaments at a time. It is very similar to PRP, but instead of your own blood, dextrose or alkaline extract from Serapin is used, as well as small amounts of lidocaine for the pain, and then it is injected to the UCL. The combination helps limit the pain while also enhancing healing effects in the area injected. The treatment also tightens your ligament by initiating natural collagen deposits on the ligament damage, which then restores tension strength. The patient gets treated every 4 to 6 weeks to allow time for healing in between injections.
One of the biggest reasons that the surgery has become so popular in recent years is that it can help to lengthen the career of pitchers who suffer from excessive elbow wear. Sandy Koufax retired very young due to lasting pain and arthritis in his pitching arm, and he feared he would lose all function of this arm if he had continued to play professional baseball. If Dr. Jobe had already developed Tommy John surgery, Sandy likely would have been able to continue pitching pain-free. Today, roughly 1/4 of all baseball pitchers receive the surgery at least once during their careers. Another reason for the increase is that according to one survey, 30% of coaches, 37% of parents, 51% of high school athletes, and 26% of collegiate athletes believe that players should receive the surgery without any injury in order to enhance performance. Finally, a shift in training and desired throwing velocity have led to an upswing in the occurrence of this surgery. Pitchers that overwork in an attempt to reach a faster pitch velocity can increase the amount of stress on the elbow. Also, weighted baseballs, which were recently developed in order to help players increase arm strength, can be very damaging to the elbow if used improperly.
Recovery from the Tommy John surgery is usually performed in 3 phases. The first phase consists of immobilization and light arm exercises. After surgery, the elbow is braced at an angle of 60 to 90 degrees for 1 to 2 weeks. A range of motion brace is worn after that to The patient should perform range of motion exercises for the hand, wrist, elbow, and shoulder, and strength exercises for the shoulder. The second phase usually starts 6 weeks after surgery, and the patient begins elbow strengthening exercises. However, they are still advised not to overstress the graft. The third phase usually starts 4 to 5 months after surgery, and patients can begin light throwing. After 6 months, patients can wind up their throws, and after 7 months, patient can begin normally practicing. After 9 months, patients can resume throwing in a competitive environment. 85% of patients can resume their sport at the same or higher levels of competition due to the physical therapy during recovery.